Good morning. I am Dr. Othonos Athos. I am the president of the Homeopathic Academy of Greece, and this is the 39th lesson that has to do with the international homeopathy lessons on classical miasmatic constitutional homeopathy. And we are once again having a case analysis done by the method of the classical miasmatic constitutional homeopathy. This is a case taken by a student of mine at his first steps, and we are going to analyze this case, try to interpret the information derived from the patient and interpret his exact own words and behavior. The way we do this is to follow a certain method. First of all, we simply read once the case, the notes of the doctor, just to get a rough idea. Then we proceed to the examination of the background of the personal data of the patient and his present illnesses. And then we go on the miasmatic analysis, the finding of the essence and the whole picture, the examination of the isolated rubrics, and the differential diagnosis. Let's proceed with the rough reading of the case. This is a case of a male, 40 years old, 175 centimeters height, 73 kilos weight, private employee, married, 2 children, 8 and 5 years old. He comes to us for chronic sinusitis, 15 years, one crisis of sinusitis, one acute sinusitis once a year, hay fever the last 25 years, and panic attacks. He mentions that he had panic attacks 8 years ago. It was the time of the first pregnancy of his wife, and since then he does psychoanalysis, and he's better too. Hot 2, worse heat 2, sweat 3, he sweats a lot. Offensive 1 to 2, offensive secretions and perspiration. Oily skin and hair 2, aversion fat 1, irritability 2 to 3. Yet he doesn't express his anger. I think that it's not a good thing to get angry. From what does he get angry? From the rhythm of life. From he who doesn't appreciate what you do for him. From those who want to take advantage of you. Never have I fought. Not once. Always want to do something. Restless too in the office. This is an observation, a non-verbal information from the part of the doctor who took the case. What about fears? Fear of death 1 to 2. Fear disease 2. Afraid of the inevitable. the doctor says that he's obsessed with his health too. He deals a lot with his health too. Counting 2 since child. What does this mean? That when he walks on the street and sees steps of stairs, he starts counting the steps. 1, 2, 3, 4, 5. When he sees cars passing by, he starts counting the cars. Or he may be obsessed by reading the numbers, the number of each car at the plate. If the green light is on before 10, then something will happen. He stops with his car on the traffic lights and he starts thinking, he cannot help but thinking that if the traffic light, the green traffic light doesn't the green traffic light is on before counting up to 10, then something will happen, something bad will happen. He is superstitious. For example, he wants to have only 1 earring, not 2. If he puts 2, then he feels bad, something bad will happen. Fear of height 2. He starts becoming afraid when he goes out on the balcony near the height, and he's afraid that he may slip and fall. What if he may slip and fall? What if he gets dizzy and fall? What if something happens and he will fall? Claustrophobia. He doesn't get into the elevator alone. Disgust 2 to 3. He will not drink water from the glass of another person or even from his close ones, from his family or his wife. He washes hands all the time, 2 to 3, all the time, 20, 25 times a day, 30 times a day. He always carries an antibacterial soap with him in his bag. Obsessions 2. He leaves the house and starts thinking. Before leaving the house, he checks if he has left the electric stove on, or if he has left an electric appliance on when not necessary, or if he has forgotten to shut the windows or close the door. He may check things 1 or 2 times before leaving the house, and then, even if he has left the house, even when he has left the house, he starts thinking whether, although he has checked things before leaving, maybe he has this idea, what if I have forgotten the door? He is not sure if he has forgotten the door open, the door of the house. In the past, I kept looking at the electric cooker for 30 minutes before leaving the house. He was not sure if the electric cooker was on or off. He doesn't fall easily asleep because of thoughts. What if this? What if that bad thing happens? He has these what if thoughts 2 to 3, day and night, not only before going to sleep. And in order to apologize for these great thoughts, many thoughts he has, he says to the doctor, "Why, doctor? Is there anyone that doesn't have his mind occupied all the time?" Nervous frequent urination. That means that when he is waiting for an important appointment, then he starts wanting to go to the toilet to pee, to urinate, quite frequent. Introvert too, about his personal matters. He considers himself smart too. He doesn't read books because he cannot concentrate. Now, this is a first rough reading. We got a general idea of this person. Let's see his background. Male, 40 years old, private employee, married, 2 children, 8 and 5. He had panic attacks 8 years ago during the first pregnancy of his wife, and since then he follows psychoanalysis and he is better too. Chronic sinusitis, hay fever. The background reveals us a person who comes to us mainly, I would say, not so much for his sinusitis or hay fever, but because of his panic attacks that he had 8 years ago. And although he had these panic attacks 8 years ago, he still does 8 years psychoanalysis. 8 years psychoanalysis in Greece is a lot. Nowadays, Greek people don't go easily to an analyst and they don't do 8 years analysis. As revealed later on, the doctor says he is obsessed with his health and he has many fixed ideas. So we have to do with a person that his mind doesn't stop thinking. Thoughts, what if, 2 or 3, day and night, and he wonders. He says to the doctor, "Why, doctor? Is there anyone that doesn't have his mind occupied all the time with bad things?" So we have a person that his main problem is psychological. It's a person that is very intellectual in the sense that he thinks a lot, and most of his thoughts are what if this and what if that. Not only regarding his health, but regarding all things. Don't forget that he has had these panic attacks started 8 years ago during the first pregnancy of his wife. We can suppose that he was very stressed, thinking, what if this happens to my wife, to the baby? What about the financial state? Will we manage with a kid, with a child in the family? And then he had 2 children. More thoughts, more worries, more concerns. He has so many thoughts that he cannot concentrate in order to read a book. So, we have to do with a person that is very intellectual and thinks a lot. He thinks a lot and he has many thoughts of the what if nature. What if this bad happens? What is if that bad happens? We got a general idea of the patient and his background. And we have already supposed and concluded quite safely that we have to do with a person that thinks a lot and worries a lot. Is this person, what is the next step? Is this person a psoric person, a psychotic person, or a syphilitic person? He is not a psychotic person because he's a very intellectual person. Psychotic individuals tend to be superficial as to intellectuality. They are more the physical types, and they care more about having fun, caring for themselves in the sense of having fun and enjoying life. They don't think so much about others. On the other hand, we have a person here that was very stressed, not about himself, about his wife, his children, the financial things, and he had these panic attacks. And no psychotic person will do psychoanalysis, and moreover, in addition, he will not do it for 8 years. Never. Forget it. He is not the intellectual person, so he doesn't appreciate or understand these kind of things like psychoanalysis. Oh, why go to a doctor, pay him a lot of money, lie on the couch and start telling about what my father did, what were my child, was my life when I was a child, what do I like, what do I dislike, for what reason? Why don't I spend my money going to have fun? All my problems will be solved if I go and have fun. This is the psychotic individual. He will never do psychoanalysis for 8 years. Forget it. A psychotic individual will express his anger a lot, immediately. A psychotic person will not care if others don't appreciate what he does for them. Fuck them, he will say. I use his own words. A psychotic person will not have so much fears for so long. He may have some acute fears if he has experienced a very dramatic event, but then after days, hours or days or even weeks, his fears will be set aside most of the time. He cares about things, about his job, about his wife and children. He has many worries about things in his mind. This is not a psychotic person. Now, is this person psoric or syphilitic? He doesn't have anything that shows us that he is syphilitic. Instead, he has many psoric, obsessive ideas about his health, about bad things that will happen, anxiety about the future. He was so worried about his wife, his family, his children, so he got these panic attacks. He cares about others. That is a psoric thing. Is he a syphilitic person that he uses these fears in order not to work because he is lazy? Is he a syphilitic person that he uses these fears in order to manipulate his wife or others? No. There is no purposeful, intentional theatrical play. He doesn't use these kind of fears in order to serve his egoistic intentions and interests. He suffers, he truly and genuinely suffers from this kind of fears. So there is no pretension, no manipulation, no exaggeration. No exaggeration, because although he has great fears, he doesn't exaggerate about them. So, in the end, we are left with this supposition, which is a quite safe one, that we have to do with a psoric person. If you have to do with a psoric person that his essence is that is a person who has always been thinking a lot, always. In the past, I kept looking at the electric cooker for 30 minutes. So, if you have a psoric person that is very intellectual in the sense that he has a mind that keeps functioning at high resolutions all the time, filled with thoughts of the kind of, what if this bad thing happened, what if that, full of obsessions, full of fixed ideas about all things, about his health, about his job, about his family, about everything. What is the first constitutional picture that comes into mind quite safely? Argentum nitricum. He is a typical Argentum nitricum case. Let's see the data, the rubrics, the expression of the patient, and the non-verbal data that support this conclusion that he is a psoric Argentum nitricum individual. The fact that he had these panic attacks 8 years ago during the first pregnancy of his wife. Worried a lot, many thoughts, and this is also confirmed later on. This matches the scenario that we have already said about his essence. And since then, he does analysis for 8 years. Only obsessive guys do analysis for 8 years. And even if they got better, they don't stop it. It's an obsessive action. You could have also a syphilitic person that will do analysis for all his life, during all his life, only to use it in order to manipulate others, that he is the victim, that he is the person with so many problems, and so others should take care of him. It's the person who doesn't want to get well because he enjoys his misery, or because he enjoys using this thing for the scenario of the victim, that is a troubled person, and that all others around him should take care of him. But in this case, it's the obsessive fear that if I stop analysis, then what if my past problems come back? That's my explanation according to his essence and to his general picture and to his miles. The explanation, this is an Argentum nitricum behavior. not wanting to stop psychoanalysis, although he's better too, because he has this obsession that if I stop analysis, then my problem will come back again. And this is confirmed to himself because of his fears and superstitions and obsessions. I still have them, so it's quite possible that I will have once again a panic attack. Hot 2, where's heat 2? These matches are geometrical. Offensive, 1 or 2. Oily 2. Quite often, agenda-nitrical individuals have also a background of sulfur, and these matches sulfur characteristics. Irritability, 2 to 3. The doctor who took the case says, evaluates this person as being irritable 2 to 3. I will not agree. It's 2, 1 to 2 or 2. Why do I say so? Because he doesn't express his anger, and because he thinks that it's not a good thing to get angry, and because never have I fought. One could say that maybe I am dealing with a person who is influenced by the Staffsagria constitution, and such individuals are up to the neck full with anger. They easily get angry, they are up to the neck, and they don't express their anger at all. So they keep boiling to the extremes, but never express their anger. But there is no clue that we have to do with a Staffsagria person. We have to do with a person that is psoric. So my supposition, according to the whole case, is that the doctor exaggerated in his evaluation. Nevertheless, there isn't any other clues that shows us that this person gets angry with everything. If he started saying my wife makes me angry for this and that, my children make me angry for this and that, my boss makes me angry for this and that, all people make me angry, then this would be the right case to say 2 to 3. But we don't have such a person. We have a psoric person, okay, he gets angry inside 1 to 2, he doesn't express it at all, and he doesn't have many reasons to get angry. He tells us that he gets angry. I think that it's not a good thing to get angry. It's a psoric philosophy. From what does he get angry? From the rhythm of life. From he who doesn't appreciate what you do for him. Those who want to take advantage of you. This is a psoric. These are psoric reasons to get angry. He is the one who is the victim, the one who cares about everything, everybody at work, in the house, but they don't appreciate what he does for them, and they take advantage of him. This is the story of his life. He's a psoric person. He's mostly the victim, the submissive person. My conclusion, my supposition is that this person gets angry from the rhythm of life. If you have an Arg.n nitricum intellectual individual that is worries all the time, he doesn't get angry from the rhythm of life. he gets upset, he gets worried, he gets stressed from the rhythm of life. But quite often, when you ask a person from what does he get angry, he may start telling you that he gets angry. Instead of telling you from what he gets angry, he tells you from what he is stressed. So we have to discriminate. My supposition is that this person doesn't get angry from the rhythm of life, he is stressed from the rhythm of life. And that's why during the first pregnancy of his wife, he got panic attacks from stress. He's full of stress, not full of anger. He may get angry if he doesn't cope up with the obligations and the jobs he has to do. Another thing that complies with Arg.n nitricum is that the doctor observes that he has physical restlessness in the office, and and he says and he confesses that he always wants to do something. He cannot stay still. Why? His body cannot stay still and is restless because his mind is restless. He says that. He cannot go to sleep easily because he is full of thoughts of the kind of what if this and what if that, day and night. And the story of his life is this restless mind. This mind full of thoughts, of bad thoughts, full of obsessions, fixed ideas. So this is the story of his life, and if all your life you have this mind that works in high resolutions, and his mind has it's like a car whose pedal of gasoline is fully pressed, while the brakes don't work well. His mind is full of gas regarding thoughts, no pedal of brakes pressed, full of thoughts. If you have a mind full of thoughts, then you have a body full of restlessness. And you want to do things all the time, and you cannot concentrate and read a book, although you are an intellectual guy. And although this person, I forgot to note it down, although he cannot concentrate to read a book, yet he is writing a book of his own. He is the author of a book. He is writing at the present. In order to write a book, you just lay down your ideas. And if you have a quick mind and many thoughts, you have rich material to write a book. But if you can't push the brake to stop your mind from his own thoughts, you cannot read other books, you cannot concentrate. Arg.n nitricum students are many times considered by the educational system as having problem with their mind of not concentrating, not being able to concentrate. Because they have this quick mind full of ideas and obsessions. He considers this kind of high resolutions and many thoughts so natural that he wonders and tells the doctor, "Why, doctor, is there anyone that doesn't have his mind occupied all the time?" If you have this kind of obsessions while waiting for an important appointment, you have nervous frequent urination, a very characteristic thing, or nervous diarrhea. This is very characteristic of Arg.n nitricum. We see these fixed ideas, these obsessions, during all the case history. Superstitious, 2. Want to have only one earring. If I have 2, something bad will happen. Obsessed with his health. He is not so much afraid about his health. We shouldn't think of phosphor or arsenicum or other constitutional pictures that have to do with fear about their health. Because this fear about health, it's an obsession. He is generally obsessive, and this also refers to health. So, fear about health, fear of disease, the inevitable. If he gets sick and he is not going to be cured, afraid of the future. He has this obsessive counting since child. Obsessions, if the green light is on before 10, then something will happen. Afraid about height. What if I go near the balcony and then I fell? Claustrophobia in the elevator. Disgust, microphobia. Washes hands all the time. Always has an antibacterial soap with him. Obsessions 2. What if I have left the electric stove on? In the past I kept looking at the electric cooker for 30 minutes. The whole whiteboard became red from his obsessions. So, this is a typical case of a psoric person, and especially of a person who is Arg.n nitricum. Are there any, Arg.n nitricum 1M, are there any similar constitutional pictures, relative constitutional pictures? We could think of sulfur also. We could think also of sulfur. First of all, we think of Arg.n nitricum. Secondarily, we think of sulfur. Because he is hot, he wears heat, sweats a lot, offensive, oily. Because he is psoric. Because he is introvert, and he considers himself smart, and he wants to write a book, possibly philosophizing and so on. Yet, these clues are only few. It could also be a lycopodium person, a psoric lycopodium that is submissive. The story of his life is to be taken advantage of, and he has many worries, psoric worries. He doesn't express his anger, he's coward, but then these clues are not much. So, this is an Arg.n nitricum person. He took Arg.n nitricum, and in 1 month time, and when the treatment followed, he was cured from his hay fever and from his chronic sinusitis, his fears and obsessions were improved a lot, and he got better in general. So, this is how we analyze cases. Because this is the 6th case analysis. As you can see, I don't say too much, I don't deal with details. We said that and we dealt with the procedure thoroughly at the 1st and 2nd case presentation. Thank you.